exam number 1. And so what I've been starting these out with is what I think probably everybody's struggling with, which it's okay. It's not the easiest thing that we look at, but there's an easy tool we can use to make it easier. Anybody else struggling with ANS drugs? Would you be able to let her in there? Kinda, just a little bit? Okay. So I'll wait until they're back in here. But I'm just going to draw my picture here. Sympathetic, autonomic nervous system is divided into both the sympathetic and the parasympathetic. And the issue with that is this is an automatic thing in your body. You don't even have to be consciously making these decisions to make this happen. These are automatic things that happen in your body. So the sympathetic system is when you're getting chased by a bear, and your fight or flight kicks in, okay? So what happens to your pupils when that happens? They dilate, right? They dilate. So then, what happens to your heart rate and your blood pressure? They go up. Yep, heart rate goes up. Because we want to perfuse all the necessary organs to get away from the bear, right? That's what we want to do. And so that's the ultimate goal there. Then your lungs, what happens with your lungs? So that's what happens with your heart. Beautiful picture, right? But what happens with your lungs? They open up, right? Because you need more oxygen to go to the rest of your body, right? So you need the best lung capacity that you can have. So it opens everything up in your lungs so that you can provide the best oxygen to all those tissues that you need to get away from the bear, right? Absolutely. And here, saliva production and mucous membrane production really is not an issue. We really don't care if we have saliva or mucus or tears. We just don't really need to focus on that, right? So we really don't need those in this situation. The peristalsis within the gut, so you've got the large intestine, the small intestines, and the stomach. Peristalsis, what does it do? It decreases and stops, yeah. Sometimes it comes to a full stop. Sometimes it decreases. And I'll grab the door here because then I know how long it takes so that I'm not taking away from anybody's time. Yeah. If you could do me a favor and you are in charge, the 2 of you, 3 of you, 4 of you are in charge of letting the next people in that might be a little late. So just be on the lookout for whoever comes in. So then peristalsis decreases. You don't need to be digesting, right? If you're getting chased by a bear, your biggest issue is you don't want to be eaten by the bear. So who cares if you're digesting, right? You need to focus and shunt your blood away from there and send it to like your heart, your more important organs, right? And also what happens, which is kind of goofy, is the liver has these glycogen stores, and your body really does need glucose at this time for all of the things that it needs to do with all of its muscles. It needs to get away from that bear, right? Just like it needs oxygen and it opens up the lungs, we also need to send out glucose from there. So we end up actually in high states of stress with high glucose levels. You'll see people who are septic. So yeah, if you can do that, that's great. We'll see people who are septic, and those people that are septic, they'll have high blood sugars. Well, they have high blood sugars because oftentimes they're sitting in this fight or flight sympathetic response. And so they're going to have high glucoses for a while because their body's getting this message that they need to send out more sugar from the liver. Maybe it's shut down this area, but it sure is sending out plenty from here. Then as far as the bladder, no pee. It's confusing because we talk about a constriction that happens, and sometimes people get confused with that. But just think about it this way. If you're getting chased by a bear, is it going to be to your advantage to stop and pee? No, you're going to be lunch, right? So, no pee. And this is what's been keeping us alive for many years as humans, right? The parasympathetic kicks in to quiet this system down, right? So what happens to your eyes here? They constrict, right? So you've got that lady who's on the cholinergic side, who's meditating. Maybe she's doing some yoga. Maybe she's going to read the paper. And so she can have those narrow little, tiny little pupils to read the paper. Whereas on the sympathetic side, that guy's running from a bear. He's got to have a great big huge field of vision. So we're envisioning those pupils being huge. Now, as far as mucus production and tear production, what happens over on this parasympathetic side? Increased tears. That lady doing yoga, pretty emotional. Saliva, she's drooling. Just picture her like that, right? And then what's it going to do to your heart rate and your blood pressure? It's going to lower the heart rate, lower the blood pressure. As far as your airways are concerned, what's it going to do with that? Close them up, yep. And for whoever came in last, your job is to let the next person in. Lung capacity, actually, we don't need those airways to be as open as they were. So they go back to normal, okay? So they shrink back down. So I'm going to symbolize that by putting the lungs up here and an arrow backwards. Peristalsis, beautiful large intestine, right? Peristalsis increases. Peristalsis increases, and then we are able to pee again. So those people that say, yeah, but when I get nervous and I'm in a play, I actually have a problem with the fact that I have to pee once I get up there. Well, that's because your parasympathetic has kicked back in, and now you're again able to pee. As far as if you're getting chased by a bear, or if you're calming down after getting chased by a bear and sitting down and doing your meditation, right? This is all normal, okay? These are all normal symptoms that you would expect, right? Everybody comes into a test, their heart's racing, right? You can feel your heart pounding in your neck. You know your blood pressure's up a little bit, right? Absolutely. But when people get medications that affect either the parasympathetic or the sympathetic side, when people get those medications,